Hey guys, Tony Maritato here, licensed physical therapist, and in today's video I want to talk to you about physical therapy beyond the exercise. And what I mean by that is I've been seeing more and more posts lately about patients saying that their surgeons don't believe in physical therapy. They don't believe that it's necessary, they don't believe that it's beneficial, and they don't believe that it can help. Now, the reality is there are so many dynamics to what physical therapy actually is. Granted, yes, I'm 1000% biased. I am a physical therapist. I work with clients every single day who've had knee replacement. But understand that physical therapy is not really just a thing. It's not somebody who comes and makes you do exercise. It's not somebody who comes and bends your knee. Physical therapy, working with a physical therapist, is about having somebody in your corner, having a coach, a teacher, a confidant, having somebody that will give you an unbiased opinion when you need it, somebody that will show you what to do and how to do it, but also somebody who is going to take your entire situation into consideration when making recommendations. You know, so often I see clients that might be the same age, might be the same gender, but have drastically different support systems at home. I'm going to tell one person to do something very different than I would tell another person. My job as a physical therapist is to understand the needs of my patient, the individual, the human that's sitting in front of me. When somebody needs support, I'm there to provide it. When someone needs a kick in the pants, I'm there to provide it. Like, I have to fill many, many roles. So if my job was just to make you do 3 sets of 10 of some random exercise, I agree. It's probably not that necessary. And I truly agree. I think most patients would probably be fine just getting back to doing the things that they enjoy, the things that they love, getting back to activities around the home. But the reality is, I've seen thousands of knee replacements in the 21 years that I've been working in the profession. I have the luxury of having all of that experience and being able to make assumptions based on that. You, the patient, do not have that luxury. So if I can answer a question for you and bring you peace of mind, if I can tell you, yes, what you're feeling is totally normal, or no, what you're feeling is a little bit unusual, we need to get this checked out, then there's absolutely value in that. So I just want you to understand, this is your body, your decision, your knee. If you believe that you need some help, you need a little extra assistance, you want somebody there who can answer your questions and direct and guide you, motivate you, encourage you, and support you when you feel like you don't want to do it today, go get a physical therapist. I would also tell you to consider an occupational therapist. Occupational therapists are phenomenal. They work with patients who have had knee replacements every single day in outpatient rehab and in the hospital. They're a hugely underutilized resource in the profession, but bottom line is, it's your choice. You have the freedom. You make the decision. Just because a surgeon says it's not necessary, maybe they've had bad experience with therapy in the past. If you find the therapist that you want to work with, your insurance will cover it if it's medically necessary. And if it's not, you pay for it out of pocket, because this is your body. This is the next 10, 15, 20 years of your life. You want to get the most out of it. Thanks for watching, guys.